The first official baby boomers are reaching retirement age. It's expected this group will redefine retirement as much as they redefined and helped shape the last 4 decades. Boomers look forward to retirement with a sense of excitement and vitality not known a generation ago. They have worked hard and prepared well to live a long and healthy retirement. Or have they?
I don't think baby boomers are as prepared as they might think they are. They've started thinking about saving for retirement with their 401k plans, but I think that most boomers have not started thinking about the possibility of a change in health and what that might cost, whether that's covered by Medicare and what they might do or where they might turn for that kind of care.
The baby boomers are a generation that embraces being in their 60s with a sense of spirit and immortality. And while many boomers will most likely live longer and be healthier and more active retirees than their parents were, the truth is, it does not take a devastating disease like Alzheimer's or a stroke to leave an older person in need of long-term care. In fact, studies have shown that 7 out of 10 people in their 60s will experience some type of health-related life-altering event.
I think boomers have a number of misconceptions regarding planning and being prepared for their retirement. That, for example, Medicare is going to pay for long-term care that they might need in the future, when indeed it's not going to pay for all the care that they might need. I think we also think about having Alzheimer's disease or a stroke and not necessarily thinking about the ski accident, the broken hip, things that perhaps are shorter term in nature.
New programs are emerging that will allow individuals to remain in their own home while receiving qualified care and services they may require should a medical need arise.
Programs that provide both financial protection against the costs of long-term care as well as provide the actual care or assistance with getting that care are really 2 very key features to programs. But also we need to think about who's going to provide that care. In many cases, the adult children no longer live in the area and people just don't know where to turn to get the care. So these programs offer that kind of assistance.
These programs are designed to allow individuals who need care to remain in their own homes while offering a lifetime continuum of care that can provide for many of their healthcare needs as they grow older.
Services are brought right to the people in their own homes, whether it's on a short-term basis, on a longer-term basis. But sometimes the home just isn't the best place anymore, and the individual is no longer safe. And so the flexibility of the plan allows for care to also be provided in an assisted living facility or in a nursing home if that's the type of care that's really best for the member.
Financial planners point out that the time is now to start thinking about long-term care needs. Programs like these can offer individuals peace of mind, knowing that their health care needs will be met and their assets will be protected as well.
The cost for long-term care nowadays, $60,000 to $100,000, is large, but if you talk about it for baby boomers who are going to be retiring and needing this in 25 to 30 years, you're talking $300,000, $400,000. That would eat up any retirement plan. They need to be thinking about long-term care insurance coverage to avoid those costs.
With the emergence of an ever-increasing baby boomer population, there is a new demand for innovative programs and services that will allow them the freedom of living out their retirement years in dignity and in the comfort of their own home. The Affordable Life Care Plan from Friends Life Care at Home is a valuable tool to help make that dream a reality for many individuals.
Friends Life Care Home was established in the 1980s as an alternative to the campus-style continuing care retirement community to respond to the desire of many people to remain in their own homes. They want to protect their financial assets, but also know where they're going to turn to receive that care.
The plan is a unique membership-based program with one specific goal in mind: to allow people to remain in their own homes as long as possible.
Some of the key features of Friends Life Care at Home include care coordination, knowing who you're going to turn to if you have a change in health, the quality credentialing, that we make sure that we know who those providers are that are coming into your home, as well as the portability. You can take this wherever you go.
It is important to independence for both of us, and to stay in our own home, which we love.
And we wanted to have the protection so that we would not eat into all of our assets if and when we ever needed the care.
And retirees are not the only ones benefiting from the Friends Life Care at Home program. Younger individuals are realizing the importance of early planning.
The experience of taking care of my own mom made us realize that we didn't want to put that burden on our children. We wanted to find a program that, obviously financial is one part of it, but what really attracted us to this program was them providing the actual care, the coordination of the care.
According to statistics, another baby boomer turns 50 every 8 seconds. By the year 2030, people over 65 will represent more than 20% of the total population.
The Affordable Life Care Program provides so much more than other long-term care insurance programs. You become a member, you're not just an insurance number. And they come out, they invite you to health care programs, they invite you to wellness programs. They want you to stay at home for as long as you possibly can.
Boomers want more control. They are going to be fighting against the aging process, and we are working to develop new and innovative programs that we think will meet the needs and desires of this new market.
None of us wants to face the idea of getting older, but it may be easier and more affordable with the services and support provided by Friends Life Care at Home, offering individuals the opportunity to invest in their own long-term care.
We've already built in a lot of flexibility in our programs that we think will help to meet the needs and desires of the boomers. They can really tailor the program in terms of the level of benefits and the level of contact with Friends Life Care at Home. As we look to the future, we are very excited about some new programs that we're currently developing that will be working with the baby boomer members to help them maintain their vitality as they age.